Hello my dear subscriber and viewers, welcome back to Akshara Akshita 2023 channel. In this video, I am going to explain about 5th series. So in 5th series, part by part I am going to cover, but first video will be always general topic on general guidelines only. So each chapter I am covering as a first video general coding guidelines of surgeries. So like that, from 5th series also, first I will explain you about general guidelines, then we'll go for separate topic wise. Okay, so those who are not subscribed my channel, please subscribe my channel and press bell button, select all, then only you will get my future videos as a notifications. Okay guys, let's start from first points. First point is, whenever urinary bladder catheter is performing along with the main procedure, urinary bladder catheterization CPT code is not separately reportable with the main procedure. This is the first point. So what is the CPT code for urinary bladder catheterization? Means 51701, 51702, 51703. These are the code for urinary bladder catheterizations. This procedure is a global surgical package. We should not report with the main procedure. This is first point. Okay. Next point is, placement of urinary bladder catheter is for postoperative drainage. For that time also we should not report additionally. That also is an integral component of the main procedure. Okay. The next point is, whenever irrigation or drainage of the procedure performing with the main procedure, irrigation or drainage procedure is not separately reportable. Okay. Then next point is, when CPT descriptor itself describing including of hernia repair, means hernia repair we cannot report separately, but hernia repair we can report with two procedure, with main procedure along with modifier. If it is different site through separate incision, means we can report separately with that descriptor of including hernia repair CPT code along with the additional hernia repair CPT code. Both we can bill separately if it is different site through separate incision of treatment of the hernia repair, then only we can bill separately with the 59 or XX modifier. Okay. So next point is, if the endoscopic procedure is converted to an open procedure, as I told you in each chapter, basic surgery coding guidelines. So open procedure only we need to code finally. So but diagnostic ICD code we can indicate that endoscopy converted to the open code, we can code additionally ICD code, but CPD, whatever procedure completing successfully, which method, so that method only we should to finalize the CPT code, we should code the finally. Okay. Then next point is, if the surgical endoscopy include diagnostic endoscopy. So this is very basic common concept. So whenever surgical endoscopy is performing along with the diagnostic endoscopy should not report separately. Okay, but surgical endoscopy performed identify the one condition, then it leads to main procedure or any surgical procedure, we can bill both code, both procedure additionally with appropriate modifier. Okay. So next point is, endoscopy procedure performing with main procedure during the intraoperative time to check any intraoperative injury. If they are performing endoscopy, means that will be included in the main procedure, we should not report separately. Okay. Then 51700 code is bladder irrigation simple lavage or instillation procedure CPT code. That code we should not report separately if it is access or visualization of urinary system. So always irrigation procedure is included in the global package. We should not report separately. So the code is 51700. Okay. The next point is, in fifth series we have separately tomy procedure for each site like kidney, pelvic, calyx, ureter. For example, nephrostomy, pyelostomy, ureterostomy. So those procedure we should check properly site wise. Okay, so when multiple endoscopy approaches at the same patient encounter are medically reasonable or necessary, then only we can bill differently, separately with the appropriate modifier. Okay. Next point is, when multiple endoscopy approach are used to attempt the same patient, only the completed procedure approach only we have to code, as I told you already. So whenever procedure performing any approach completed by which approach, so that approach only we should bill find last. Then when ureteral catheterization or ureteral dilation, the CPT code is 51701 to 51703, is necessary to complete more extensive procedure. So ureteral catheterization or dilation CPT code should not report separately. Okay. Then so ureteral anastomosis procedure described by CPT code 507402, 50825 and 50860. So in general, they represents mutually exclusive procedures that are not reported together. If one type of anastomosis is performed on one ureter and different type of anastomosis is performed on contralateral ureteral, so appropriate modifier LT/RT should be reported with the CPT code. Okay. So for example, procedure CPT code 50860 is performing in one site and 508002 50830 is performing in another site, means we can bill both code with appropriate laterality modifier. So usually if same type of anastomosis with the same side, we should not bill it. If it is a different type of anastomosis with the contralateral side, we can bill both with the laterality modifier. Okay. Then next point is, whenever cysto-ureteroscopy or transureteral procedure performing, all fluoroscopy guidelines is included. We should not report fluoroscopy procedure additionally. CPT code is 76000 77002. Okay. Then all 76000 is an integral component to all endoscopy procedures when performed. Then next point is CPT code 50650, ureterectomy with bladder cuff. It is separate procedure. So code description says it is separate procedure. So you can remember that. So whenever separate procedure, that CPT description itself mentioning separate procedure shall not report with the other procedure on ipsilateral ureter. If it is contralateral ureter, we can bill 50650 in separate procedure CPT code with the other procedure code. If it is contralateral means, if ipsilateral means, we should not code it. Okay. The next point is CPT code 52332 and 52005. Should not report both the code with if it is the same ureteral site. If different ureteral site, we can bill it. Same ureteral site means 52005 should not bill with the 52332. Then the last point is cysto-ureteroscopy with the insertion of invendling ureteral stent. We should not report separately when performed for temporary ureteral stent during the diagnostic or therapeutic cysto-ureteroscopy. We should not bill stent code. So if it is stent is performing temporarily during the other main procedure, should not bill it. Okay. So that's all about the general coding guidelines, overall general coding guidelines for ureteral system. So if you have any doubt, please comment, and if you like this video, please like and share to your friends also, and don't forget to subscribe my channel. And in next video I am going to explain topic wise, like genital urinary, male, reproductive system male, female, then abortion related deliveries. So I'm going to cover each topic separately in next videos. Please please follow my channel. Those who are going to write CPC exams, my channel will be very useful to clear your CPC exams. So I am frequently posting tips. So the main important videos is CPC coding tips only. So the way how we can search that answer from our book itself, those videos I posted in English and Tamil version. So those who are not watched those videos, please watch that video from playlist, and please check my blogs frequently whenever I am posting new post. Okay guys, thank you for watching my video. Thank you. Bye bye.